this is a hopefully helpful visual demonstration of how to get the baby to tilt their head back. So the head tilt's really important for getting a good, deep, comfortable latch. The reason being because if you don't open your mouth very wide and then you stick your finger in, you kind of hit your tongue. Whereas if they tip their head back and they open wide, you can get right the way down to the back of your throat, and that's where the nipple needs to be, right at the back, to really get that effective, comfortable latch, good milk transfer, good supply going on, etc. So head tilt is an important part of getting that gape. You can try it for yourself. Check your head back and open. You can see how much wider you can get as if you're tucked down on your chin and opened up. So things that you can do to really help with encouraging that head tilt are positions like the laid back position, where they naturally can follow their reflexes. So when you stick them up on your shoulder and they're bobbing around like that, it's because actually they can do a lot of the stuff themselves. So if you can do that laid back position and just let them find their way, that can be amazing. Actually, if you are in a sitting up position, with a newborn especially, it's often useful to use the cross cradle hold. So if you're feeding on your left side, then you use your right hand around the baby and left hand for your boob. The first thing is making sure there's nothing on the back of their head, because actually if you have your hand on the back of their head like that, or a finger up like that, then they can't tilt. So it's important to make sure you're in the kind of crook of their neck, around their shoulders, and that way the weight of their head will fall into your hand like that, which is really helpful. Back of their skull, they can't go, so try a bit further down so that weight of that head can fall into your hand. So wherever you're holding them, make sure that you are not restricting that head at all. Okay, just try going a bit further back around their shoulders. Another thing you need to do is make sure they're in a really nice kind of straight line, because if they're scrunched up like that, again, if you scrunch up, you just can't open your mouth very wide. So we want them nice and straight out, not sort of tucked in like this. So straight out like that, and really tucked in tight to you. If you have them far away from you like that, then they're going to come on straight. If you tuck them in really tight, that naturally helps with that, getting that head tilt and that kind of nice, almost diagonally position to you, rather than straight across the front. They're a little bit diagonal to get that head tilt. So tucked in really tightly into you, and in a nice straight line, kind of arms either side, because again, if the arms are across the front, then you can't get that really nice tight tuck in. Tuck that bottom in, because you see when you tuck the bottom, immediately that head tilt goes a bit more. So tucking that bottom in really tight, and having their chest and their hips onto you and their chin really helps with stabilizing them and finding kind of where they're going and stuff. So yeah, nothing on the back of their head, making sure they're tucked in really nice and tight and in a straight line. Body's all straight out, not scrunched up like that. And then making sure pillows are out of the way, because I know that pillows are really lovely for getting comfortable afterwards, but actually when you have a baby kind of lying on a pillow during the latching process, it can really stop that head from tilting, which is not useful. So get the pillows out of the way so that they can do the head tilt, and then once you're comfy, if you want to get some pillows in afterwards, then great, but ideally for the actual latching bit, get the pillows out of the way. So you've got them in nice and tightly into you, straight line, they're not turned, there's nothing in the way, they're almost splattered onto your body like that. Your hand is in the crook of their neck and round their shoulders to support them that way. And now have a little look where your nipple is in relation to their face, because what we want actually is not them lined up so that the nipple is opposite their mouth. Pull them in the direction of their feet so that actually your nipple is almost up by their eyes. We talk about nipple to nose, but actually it's really quite far up their face. And you want it, rather than pointing directly at them, if they're tucked in really tightly into you, that bottom lip and chin will be wedged onto the breast already. So if you can pull them in the direction of their feet and get that chin planted onto the breast so that the nipple's up there, that will really encourage them to do that kind of rooting around and head tilting. Don't be tempted to, the minute they start to open, sort of move the boob down and in. Stay where you are with it, because as they tip back and open wide, that bottom lip stays there, and they should stay nice and wide, and you'll be able to literally just bring them forward at that angle, chin first, so that they come on really nice and deeply at that angle. They should get a much better head tilt that way. But yeah, get that chin planted on really nice and tightly like that. Trying to think if there's anything else. So tight into you, nothing in the way. I mean, they talk about not even being able to see the poppers down the front of the baby grow. That's how kind of tight in you want them. Hips on you, chin on, chest on you, chin on you, but chin onto the breast, nice and firmly in that angle. Tucking that bottom in really helps. Nothing on the back that way. Pillows out the way, and really just sort of stay up by their nose and wait, really wait, you know, stay up there. And as they start to tilt and start to open, sometimes you almost need to just follow their nose and chase that nose to make sure that bottom lip stays well away down there. Once you've got that wide escape, you can poof, wallop them in, chin forward, and you should get a bit more of a comfortable latch. But it does take time. It does take a bit of practice and learning. It's not the easiest thing. I know where I've whittled on now for a while, but hopefully helpful. Bye.